So we have recently completed a phase 2 proof of concept clinical trial in C. difficile infection. This was the CODIFY study, and we recently published this in the Lancet Infectious Diseases, so I encourage you to go and look at the data in more detail. But this was a 100-patient study run in North America and Canada. Two-arm study comparing Ridinilazole to vancomycin, which is probably our accepted standard of care. And the primary endpoint for the study was sustained clinical response. And this is an endpoint that's becoming very well established in the field of C. diff clinical trials, and is defined as cure at the end of therapy and no recurrence in the 30 days post end of therapy. So it's a really neat endpoint. Captures the course of the disease, the initial infection, and do we see a recurrence in that high-risk 30-day window after we've completed treatment. So it really tells you if you've got a drug that treats CDI and reduces the recurrence of CDI. And the data we generated was extremely encouraging. So around 67% of the Ridinilazole treated patients had a sustained clinical response, so cured, no recurrence, whereas only 42% of the vancomycin treated patients had a sustained cure. And that's really, an absolute difference of almost 25%, which is a very significant improvement and actually genuinely clinically meaningful in terms of minimizing recurrences. And this is what we want to do. We want to have sustained clinical response, sustained cures for patients. And what drove this improvement in sustained clinical response was the reduction in rates of recurrent disease. So around 35%, 33% of the vancomycin treated patients who were cured at end of therapy went on to have a recurrence, compared with only around 14% of the Ridinilazole treated patients. So a relative reduction of around 60% in rates of recurrent disease. So we saw good cures and we reduced rates of recurrent disease. So really exactly what we're aiming for with Ridinilazole.